The average American spends over $12,000 a year on health care. That's more than most people pay in rent or groceries. But despite this sky-high cost, many still can't afford to get sick. In a world where hospital bills pile up, stress becomes a constant companion. Patients sit in waiting rooms, anxiety etched on their faces. Why is U.S. healthcare so expensive? Let's explore the reasons behind this staggering reality.
Let's break it down. Where does that $12,000 go? A huge chunk goes to hospital services. Another big piece? Prescription drugs. But one of the most surprising costs is administration. Paperwork, billing systems, insurance forms, and people just managing the chaos. In fact, U.S. healthcare has some of the highest administrative costs in the world. Here's the real shocker. The U.S. spends more than double what countries like Canada or the U.K. spend on healthcare, but ranks lower in outcomes like life expectancy and infant survival. In those countries, healthcare is seen as a right, not a business, and the government plays a central role in negotiating prices. So, why don't we just change it? Because it's complicated. The U.S. healthcare system is a mix of public and private sectors tangled in regulations, lobbying, and a whole lot of money. The healthcare industry spends hundreds of millions lobbying lawmakers. And everyone, hospitals, insurers, pharma, wants to protect their piece of the pie. Meanwhile, real families are caught in the struggle. 1 in 4 Americans delay medical care because of costs. Even with insurance, high deductibles and surprise bills loom over us. Meet the Johnsons, a middle-class family facing tough choices. They want to prioritize their health, but the bills keep piling up. Every decision feels like a gamble, and their health hangs in the balance. It's a reality that too many of us know all too well. We need to change this narrative. Healthcare should be a right, not a privilege. Fixing healthcare in the U.S. won't be easy, but it's not impossible. Some states are testing new models. Some employers are cutting out insurance middlemen, and people are speaking up, demanding more affordable, more accessible care. Together, we can create a system that works for everyone. What do you think needs to change?
If this video helped clear up something you've been curious about, give it a thumbs up, share it with a friend, and hit that subscribe button for more insights on tricky topics. Have a story or opinion to share? We want to hear from you. Drop it in the comments.